Hello, good afternoon, everybody, and thank you for being here today with us at our webinar, The Cost of Inaction, Sustainable Finance for Non-Communicable Diseases in Latin America and the Caribbean. We are going to start with our webinar. I'm Sophia Birch, and I'm part of the team of the IX that is holding this webinar and hosting it today. Welcome, everybody. I'm going to give the floor to Federico Augustowski, doctor and researcher and director of the Department of Health Technology Assessment of DIX and principal investigator of the FAN project that together with Roberto Yunes, economist senior from the World Bank, will open this seminar. Thank you. Thank you, Sophie, and welcome you all and good morning, good evening. It is a pleasure to have you here today. I believe Roberto is not here yet, but he's about to join us. The idea is to try to share during this hour together a report that we've just launched. We did a preliminary launch in the World Health Assembly in Geneva of a prior stage, and this is the official launching of this report that tries to provide a diagnosis and action plans as to financing of non-communicable diseases in Latin America and the Caribbean. Let's hope that we can take advantage of this. Some rules. We are going to use the chat questions and answers. Sophie and Cody are going to be answering some questions, and you can leave questions to the members of the panel. That will come after the presentation of Natalia Spinola. And is Roberto here or not? I don't know. Otherwise, I will give the floor to you, Sophie. Just to comment that the World Bank is one of the partners of this FAN project that we are going to be telling you about later on. We will start with the first block of this presentation. I will give the floor to Natalia Spinola, coordinator of the IX, for her to tell us about the regional diagnosis situation and the finance of non-communicable diseases. Thank you, Sophie. In these minutes, I'm going to be sharing with you the results of this test. And as you said before, and as Federico said, this study was done with part of the Financing Accelerator Network for NCDs, known as FAN. And the idea is to provide an answer to this key question, which is how are countries financing their strategies for non-transmissible or non-communicable diseases, limitations and obstacles to do things better. This study was performed thanks to this multidisciplinary team supported by the IX as an institute that combined the experience in health technology assessment, epidemiology, and communication. As you can see on the screen, you have the leading and scientific team that made this technical assessment possible and the performance of the report, of course, and the collaboration of the communication team and the assistance team that achieved being present today with you, telling you about all this. If we put numbers to these things, we know that non-communicable diseases cause approximately 65% of all the deaths in the region of Latin America and the Caribbean. And perhaps um, not minor issue is that 38% of the deaths for NCDs occur before the age of 70, and these deaths can be avoided. We also know that non-communicable diseases have a high economic burden for the healthcare systems, the homes of people, and economy in general. There was a study published only for tobacco smoking, and tobacco consumption generates $26.9 billion estimated for 12 countries in the region that concentrate 80% of the GDP of the region. And macroeconomic burden, we can see that it is estimated that NCDs reduce the economic growth between 0.5 and 2% in many of the countries of the region. Therefore, now the region is not paralyzed, of course. There are visible improvements, as you can see, and benefit packages, etc., models related to performance. There are taxes on risk factors like tobacco, alcohol consumption, and soft drinks. But this progress is fragmented inter-systems and finance players, and this is a drawback. Also, the implementation is uneven and unequal between and within countries, and there is a disconnect with the strategies of financing the long term. So the key conclusion to this analysis, which is our message throughout the presentation, is that the challenge is not politics, but coherence of the system. The region has a lot of instruments, but it doesn't work as a finance system with coherence. The methodology, the report was constructed with three sources of information. One of them was the documentary review of 157 documents in the last 5 years, 2020 to 2025, where there was a taxonomy implemented based on the World Health Organization, based on three pillars: resource mobilization, acting together or shared strategy, and strategic purchase. We based ourselves on the four groups of NCDs: cardiovascular diseases, diabetes, cancer, chronic respiratory diseases, and also we incorporated evidence on mental health and renal disease or chronic kidney disease. We included also interviews, 21 interviews to 22 key authors in the country. And the third source of information was a dialogue of validation done in April this year in Buenos Aires, where there was the participation of 45 key authors of each country, representatives from the government, international organizations, civil society, and technical players that achieved the validation of the findings obtained through the interviews and the documentary review. And there was space for identification of FAN priorities for the next stage in Latin America and the Caribbean. With all this information handy, we were able to triangulate and to integrate all this in the report of the project. As to the results, we've identified four structural barriers that emerged in the 10 countries alike. These are not subsystem problems nor national problems, but rather regional. One of them is fragmentation, that was the most frequent one, where we found multiple finance schemes, parallel programs, and players that operate in silos with limited incentives for integration. The second barrier that we came across was limited visibility to finance. There is no clear image of how much the region spends in non-communicable diseases, how we assign resources, nor the results generated. The budgets for NCDs are imbued of the general guidelines for budgets. And this is not only a national problem, but the database statistics of spending in health of the World Health Organization do not show statistics of the share of the expenses in NCDs and the overall impact in total or general health. So we don't know where we are standing in order to assess where we are heading for. Third, we have the barrier of policies and implementation. The countries have national sound strategies, but they are not consistently translated into scalable, easy to adopt programs. In the region, we have instability at a political level and political cycles that erode these possible strategies. And the fourth barrier identified was the underinvestment in prevention. In the region, the center of policies are concentrated on hospital interventions to cure and of high cost. So we saw that primary prevention and mental health are economically underfinanced. Let me stop now at fragmentation that we consider or we identify within the analysis as a barrier that may have consequences as to the results of financing in the region. This has to do with these four factors that we see in the presentation. First, we have the schemes of insurances or health insurance and parallel systems that limit the redistribution of the financial risk. And this results in that at present in the region, we have a high level of spending, out of pocket spending that represents 30% of the spending in health. Another thing is inefficiency due to parallel programs that generate juxtaposed investments and wasted capacity. This reduces efficiency of the healthcare system for the management of NCDs. In fragmentation, we can see throughout the continuum of attention, we can see that this undermines the focus centered on the patient for the management of non-communicable diseases. And fourth, related to fragmentation, is that the system of informations that we have act as a repository, a data repository rather than a tool for decision making. So the spending on non-transmissible diseases is untraceable in most national budgets. Therefore, a little bit what summarizes all this is that not our region lacks solution, but we lack integration, continuity, and scale. In the report, we identify possible progresses to move forward. We may have a summary on the slide. We want to improve the use of healthy taxes. In the region, We have these healthy taxes on tobacco, smoking, on soft drinks, and on alcohol or spirited drinks. The problem is that what we get from these healthy taxes is not rechanneled to healthcare programs. So we want to create a connection between what is levied in taxes and the spending in programs regarding non-communicable diseases, that these taxes be not diluted in the government funds. The second thing is strengthen communication and information systems. We have to improve the comparability of the spending in non-communicable diseases. We need to develop regional indicators in order to support decision making and accountability. The third thing is to invest on prevention and reinforce the financial protection to obtain to reduce the out-of-pocket expenses that generate these chronic conditions. The fourth is to align the mechanisms of payment with results in the long term, to relate the supplier payments to results in the long term, to make progress in regional planning, and the countries talked about their concern for high-cost technologies and drugs, and we want to support existing programs with a potential to scale up. We have experiences in the region that we need to document, and this is going to help us generate evidence to see which are the successful innovations that can be scaled up beyond the pilot stages and that may survive in the long term political transitions. In the regional dialogue, we saw something very interesting is that countries do not want framework concepts, but they want practical support for the existing efforts to work better and to work at a better scale. In the regional dialogue, we've identified 4 priorities where the participants were coherent. And this has to do with these 4 entry points: better data and visibility of financing efforts, if necessary, more traceability of the spending in NCDs to strengthen planning and to prioritize and also to have a better accountability. The scaling of existing programs in the report, as you see, and also we know some experiences in the region. We have programs of high impact, like the program of Sumar in Argentina, Popular Pharmacy in Brazil. We have to provide financial support to scale up these programs with integration to the system. Another thing has to do with the learning of experiences and regional collaboration. In the regional dialogue, we talked about platforms between countries to share lessons learned in these 3 areas of finance, of healthcare that we mentioned before, and also in order to generate data that be used in the decision-making process, sorry. And the fourth priority is related to tools for access and prices or price setting to generate regional information about the prices of drugs, agreements of access. We have some experiences in the region and strategies of negotiation that we've identified and can be a maximum priority for the governments. So this is the last slide, but not the least important one. It's the most important one because here we transform the diagnosis to an invitation to action. The restriction identified is real. The fragmentation is the key barrier, but it is not the absence of tools. It is the lack of integration, continuity, and scale. The opportunity is also real. The scale is at reach. We have promising instruments in the region, so the question is not what we need to do, but rather how to make it work in a sustainable, scalable way and aligned to the realities of each country. And what is needed is, in order to answer these questions, we need aligned efforts between the partners and within the partners in order to scale up these programs, to strengthen the visibility of finance, to improve access and prices, and to favor learning amongst countries. So with this, I conclude my presentation, and all these findings are going to help us as a starting point for the next panel. And I invite you in the chat. If you want to ask questions, you may do so. Thank you very much. Very interesting, Natalia. We are going to change our agenda and we are going to welcome Roberto Yunes. He is senior economist of the World Bank and director of the initiative Health and Rights. Welcome, Roberto. We listen to you. Thank you, Sophia. Can you hear me? Yeah. Perfect. Okay, great. Then. And now you can see me well as well. At the beginning, I couldn't connect myself and we had a technical problem, but maybe, and I want to profit from the last words of Natalia to comment to you where this model stems from, this work proposal that the World Bank has been developing with Access Accelerator, the Financing Accelerator Network. What we are seeing today is the result of a collaboration that has existed between Access Accelerator and the World Bank. And this has evolved over time, and we have come to the idea or perception that we should walk together towards a new direction in the sense that we need to bring this work closer to us and closer to the countries. And the idea was to develop these networks amongst countries, especially to work together towards what Natalia said, towards the need of aligning efforts. What we are trying to achieve through this new model is to construct regional networks. We've started with Africa. There is already a network in Africa, and now we are expanding all this towards Latin America and the Caribbean, and therefore this would be the second network, regional network, and the next one would be with East Asia. Therefore, the idea is that we want to try to consolidate, to learn, to disseminate, and to exchange experiences amongst countries, amongst governments, projects, and players, so that the efforts do not remain fragmented and isolated, as was said before. So the idea is that we are going to be constructing all this at a regional level, but as the regional networks are set up, we want to work together towards a global context because there are experiences in different contexts that may be adapted or adjusted to the specific contexts of each region and each country. So we are very optimistic with this new model. We've learned about a lot of things based on what happened in Africa, and now trying to make this effort in Latin America and this work that the IX has been developing as an organizing site or hub for this network, for this region, will allow us to be successful and will make us see that we will be successful in the region. So I wanted to welcome all of you. We've already listened to a very interesting presentation done by Natalia, and I will leave you with the next members of the panel. Thank you very much, Roberto, for your words. And thank you also for showing us the work that is being done in many regions, which is very interesting. We are going to start with the next block of our presentation in the agenda, which is a reactive panel that will be moderated by Dr. Rubenstein. He is the director of the Center for Implementation in Healthcare Policies of the IX, and he is former Minister of Healthcare of Argentina, of Health of Argentina, sorry. Thank you, Sophie, and welcome you all. Thank you. The idea is to show you a panel. We will have a round table, a panel, and we are going to try to think about the conclusions and recommendations that we were able to obtain on the base of this on the basis of this report, this research work, and also the workshop we held in April. I'm not going to repeat what Natalia mentioned in her report about NCDs, that they amount to more than three-fourths of the disease burden, especially in the middle income and low income countries in Latin America and the Caribbean. And even though prevention and control of these conditions uh, become visible in the healthcare agendas, most services, primary healthcare services, basically, and the public sector still focus on maternal care or some other conditions, even though we may count on some experiences and instruments and mechanisms that have resulted to be successful for the mobilization of researches, for fund gathering. Many initiatives find structural barriers related to segmentation, fragmentation, plurality in the finance and in the organization and rendering of services. Beyond all this, there's a lot to do. And even though there are many barriers, there are entry points as well. Many of them have been identified in this report, and they may allow us to move forward with the implementation of these structural reports that are necessary to put in the center of the agenda NCDs. Therefore, let's reflect on some of these aspects and points of discussion that were submitted in the report or presented in the report. We've invited three panelists, a very good reactive panel. Uh, and the idea is to ask each of them a question. Let me start by introducing them. Javier Guzman. Javier is the head of division of health, nutrition, and development of IVIR. He was leader at the Center of Global Development and in many non-government organizations at the global level, and in Colombia, his country, where he was director of INVIMA and an agency that was highly committed with the assessment of technologies in his country. And his experience covers from safety policy for drugs and many other strategic aspects that have to do with health. Javier is doctor as well. He is a physician, which is rare in a multilateral bank like the IDB, and he was trained on public policies as well, which is a bonus. Maria Eugenia Bonilla, Maria Eugenia Maru is leader of the Human Development Program of the World Bank for Argentina, Paraguay, and Uruguay. Previously, she was main economist in the mechanism of finance and global practice of health, nutrition, and population of the World Bank in Argentina, Mexico, and Panama. She led many operational activities and of technical assistance on health finance coverage in many countries around the globe, and non-communicable diseases, chronic diseases, where I interacted from the ministry with her on many development programs that we had with finance of the World Bank and focused on chronic non-communicable diseases. And finally, Ernesto Báscolo is an economist and head of the primary care unit of the Pan American Health Organization, PAHO. He has more than 30 years of experience in health policies, including the moving of resources. And also with Ernesto, we have interacted many times during the last years. Once this has been said, we are going to shoot the first questions. The first question is for Javier Guzman, who told me that he might have to leave before because he has other commitments. So let's start with Xavier Guzman. Javier Guzman is basically the head of the Health, Nutrition, and Development Division of the IDB. Javier. As I was saying, many innovative, successful instruments that have improved prevention and control of non-communicable diseases already exist in Latin America. Nati told us in the report. We may talk about SUMAR, the REDES program in Argentina, the AUGGs in Chile, and in Colombia as well, some other examples. Nevertheless, and as was said before, the fragmentation, the lack of institutionalization of some programs result in that these initiatives, many of them supported by organizations like the IDB, are not sustainable in the long term and may not survive the political discontinuity and changes of government. From the experience of the IDB, the question is, which are the main mechanisms for technical and finance cooperation in order to provide these initiatives a survival to these political cycles without creating redundant structures other than the existing ones? Thank you. You are muted, Javier. You're muted. Yes, please, can you remove uh, the slide, the presentation slide, please? Thank you. You are muted, Javier. You're still muted. You might start. Maybe you, okay, yes, I was muted. I'm sorry. Sorry. I was sort of blocked, but it was not on purpose. Yes, I feel welcome by all of you and congratulations for the study and thank you very much for the invitation. I believe it is a very important moment to hold a conversation and if we align messages and strategies and we articulate strategies as a sector, we will do better. Many times, as an official of the bank, in the healthcare sector, we don't get involved in conversations that act as a chamber where we listen to ourselves alone, but we are heard by many sectors, and we constitute and expenditure. Today, the money goes to health. Tomorrow, it will go to water systems or to transport. So, as a sector, we may have or we should have a coherent narrative or speech. Before dealing with your question, Dolphy, I believe that we are in a difficult situation because health spending is lower than what we would like it to be in the region. And uh, in the region is 4% of the VAT. Uh, However, this spending is going to increase. We performed a study at the bank, and we believe that the spending is going to increase threefold by the year 2030, 2050, 400% in the Dominican Republic, 180 in Guatemala, 500% in Panama. So the spending will increase if we don't do anything about it. This has to do with technological pressure as well. And this has to do with the presentation uh, spending that will increase with tax limitations where spending is not going to increase, but they are going to keep it. So we are not going to increase the spending. We will want to do more with less. So the question is, how can we achieve this? With which strategies? With what efficiency? And this is, in a certain way, the way in which we consider the situation from the point of view of finance. And strategy has to do with structural changes. We are speaking about reforms that need not be the big bang, that modified sort of the whole system. Um, as we saw in Mexico, in Colombia, in Chile. However, um, to give you an example, now we are supporting Panama so that the healthcare ministry, at this moment, we don't have a framework for integration. And this is a type of change that is feasible, and how these systems can be articulated from the point of view of operations, of access to quality services, etc. And probably in the future, we may speak as well about sharing resources. I believe that this is one of the reforms that uh, is very significant. Secondly, I believe it is clear that in chronic diseases and in these challenges we have ahead of us, we need to have a very strong primary care. And not to downplay it, it doesn't necessarily kill us, primary care. It used to be very nice, but now this is practical. And we need to be connected, working in networks, and conceive primary care not as an entry gateway, but an element of promotion, of seeking communities, and of follow-up. Because all these NCDs, part of what we need to do is prevention, early diagnosis, and after that, prevention of secondary complications, not only reduce cost, but improve quality for our patients. So this primary care uh, 2.0 is one of the strategies we based ourselves on. We work in a certain way with the countries on this. We have a platform with the PAHO organization and the World Bank. I believe there's a lot more to do. I think that this is a space that, as multilateral and as countries, we need to strengthen what this primary care means, how we achieve finance, how we take it to other levels. The third thing I would mention as a strategy has to do with the identification of the main spending elements within the system and the main elements for maximizing value in health. This study gave us some ideas. It talked about input or drugs, but I believe that we need to think about as well, on the one hand, on waste, whatever is connected with these interventions or services that are repetitive or not pertinent. And there we are going to base ourselves on the digital transformation for this identification. And I believe it is also important to look into the human talent in healthcare and the changes ahead, not only in relation with having other professions or other than the existing ones. It is going to change, and this will change the way we maximize the result of investment in human talent in health and the productivity of human talent in health. And I mentioned this before. For us, I believe that this is the moment for digital transformation as a facilitator of reform, of continuity of care and efficiency. We have the tools. The important thing is how to put them into operation. With Bajo, we work on a very big ambition, which is the Pan American um, healthcare road or route. Uh, we want each country to provide their full potential regarding this element that will facilitate many of the objectives that I've mentioned before: efficiency, equity or equality, and quality. Thank you. I will stop here. Thank you, Javier. Now we will continue with Olmar, with Maria Eugenia. There are taxes on spirited drinks, soft drinks, and tobacco. We've identified initiatives in these areas in many countries in the region, and these are very important instruments to reduce the burden of chronic non-communicable diseases and increase the space for taxes. Nevertheless, only 9 countries were able to identify that they uh, partially reverse these funds for prevention and control for non-communicable diseases. And external finance through loans of the banks are still marginal vis-a-vis the scale of the problem. My question is, from the experience of the World Bank, in order to seek the improvement of taxes for health, which are the reform packages, tax, governance, or design of instruments for earmarking of funds to be used in prevention and control of chronic diseases? Which of them could you recommend, basically, so that all these taxes achieve financing chronic diseases? And what is the role in this scenario of global health and finance of health at a regional level? What is the role that multilateral finance may have, for example, the banks, to catalyze this change in the next years? Well, good afternoon, and thank you for the invitation. Perhaps in order to get started, I would like to center my answer on healthy taxes. And I believe that before talking about allocation of taxes that arrive at a specific spending, it will be worth to talk about how to improve the design of these taxes. We want to make sure that they exist, even though we have some in tobacco. There is a lot of space to work on taxes on soft drinks and spirited drinks. I believe that first, before speaking about allocation of taxes, we have to improve the design of taxes. We need to index them because otherwise they lose value. And also, we need to ensure specificity of taxes. On that basis, how to design them better and make sure that these taxes exist. Because as to spirited drinks and soft drinks, I would rather say that we should have taxes on food and tobacco, but in addition to a better design, because if we don't optimize the taxes we get, there is little space to talk about allocation of taxes. As to the allocation, the truth is that throughout the world and in many countries in the region, there are certain rules to assign the taxes gathered or levied under healthy taxes. Now, regardless or independently of all this, and there is a design aspect here because the rigidity of allocation may be counteractive, and in certain countries of the region, budgetary laws do not allow for a rigidity or a hard earmarking of these taxes. So it is important to think there on how to redesign this assignment or allocation, but so that we can follow this up and that the country directly has a political commitment and that we can follow this up before this being too rigid. There is a good example cited by the document that speaks about what Jamaica did, the allocation of taxes on tobacco and other taxes, the allocation to the World Health Fund. But since these were strict taxes, when a tobacco company closed, the income from these taxes or the revenues were also reduced. So we need to know how to design the tax as such and the allocation in order to permit flexibility. But nevertheless, why do we use or why did we think about allocation? Sometimes a strict allocation based on the political economy of the moment allows us to test this income. And without a strict allocation, they wouldn't be approved. But if we can achieve approving or approval of all this, there should be flexibility to avoid design problems and flexibility in the use of resources. And once we think about this, we need to think about the design and we need to think as well on the fact that the international experience among different countries, these taxes are used to reinforce the public policy. In the case of tobacco, they are used to reinforce anti-tobacco laws. Or in Latin America, there is an example that has to do with taxes on soft drinks. When Mexico establishes this tax, part of the resources we're going to put water filters in the schools. And we wanted to reinforce what the government has to do as far as policy is concerned. Some countries would, or some groups would lose because of an impact. For example, the tobacco producers, but there may also be the idea of thinking about a more global tax, which is what Jamaica did. the resources that go to the tax and that go to a fund or an insurance, which is what Philippines did and many other countries as well. And as to the amount of things we need to think about when we design these type of taxes, we need to take into account that the resources are fungible. Therefore, one allocation which is very strict will not necessarily in the end increase the resources going to health if there is no real commitment, because some other revenues from the sector may be used for something else. I have only 1 minute left, and I only wanted to tell you how could we, in this sense, in the sense of taxes, how could we help? Well, by bringing experiences of what other countries do, of what has worked and what has not worked in Latin America and the Caribbean and the Americas in general, and also experiences or technical support in the designs of taxes, designs of mechanisms of allocation, designs on how to use things, and the traceability of the spending. And also, in general, the problem of chronic non-transmissible diseases is a big problem that no multilateral organization can solve by itself. And this is why I'm referring to the small part that has to do with taxes and the possibility of allocating them to a specific health cost. Once again, we need to be extra careful because an inflexible allocation may be counteractive, but once again, this allocation may help the taxes be approved, but we need to think about a soft allocation, flexible, with a commitment backing it to make sure that these resources will increase resources for healthcare and in particular for programs of prevention of NCDs. And I'm going to stop here. Thank you very much. Thank you very much. And now we are going to go to the last question for Ernesto. And this question has to do with that the report states that even though strategic purchase is the most advanced one in our region, the spending in non-communicable diseases is very difficult to trace. The traceability of the spending is complex and practically not available in any country. An example identified, for example, Chile, based on the reports of the health ministry, 0.7% of the public spending is devoted to promotion and prevention of NCDs. And these are data whereby we see problems in the identification of where the spending is in civil society, in the public and private system. The problem doesn't seem to be that of diagnosis, but this has to do with what Maru was saying, design and incentives from the PAHO organization, and given your role in the leadership of primary care and the design of strategic purchase that may be through benefit packages or payment mechanisms or hiring of staff providers. How can you guide finance to prevention at the first level of primary care? And what conditions do you think should be implemented for these changes to be viable in the next years? Before I start, I would like to congratulate you for the work done and also for this event. And I want to enjoy this panel Thank you very much for allowing me to do so. I want to express to you that being here with colleagues from the IDB and the World Bank is for us a great opportunity, and also based on the content and the strategic discussion. In order to deal with the problem, I need to provide an introduction and characterize the challenge ahead. It is not simply about incorporating uh, provisions, but modifying the matrix of the way in which we organize healthcare services and give an answer to this problem that Natalia explained very well in her presentation. And there is a word that resonated, and I believe that is key, not only in the diagnosis, but also to construct a roadmap that has to do with the fragmentation and also at different levels, not only at a macro level, but fragmentation of the organization of services. And in order to organize this answer on how strategic purchase may deal with the fragmentation in the organization of healthcare services, I would point out four axes that are key to deal with fragmentation, that are connected with integration. One component has to do with the continuity of care. The second pillar has to do with the social determinants and how to integrate in the territory different interventions amongst the different sectors, how to deal with fragmentation, how to integrate the health programs so that they don't work in parallel in isolation. And also, and last, this component that includes the others, and you expressed it very well, Dolphy, which has to do with how we integrate and also how we emphasize and provide more emphasis or a better strategic role to prevention and promotion of health. And within this framework, and I'll go one by one, strategic purchase for me is a must. And even though we may be leveraging and collecting lessons learned in different contexts, it shouldn't be an answer in terms of a recipe. We should be thinking clearly on how to leverage certain initiatives, adapting them to each context. The first element is key. When we speak about integration, we need to think about mechanisms or payment mechanisms to promote continuity of care. This implies incorporating mechanisms of payment to incentives in order to favor reference and counter reference to favor primary care level. And the issue of prevention should be part of the continuity of care at the different levels. And also, of course, based on my role, the importance and strengthening of the first level of care, always with a view to healthcare continuity. The second component that has to do with social determinants is why not incorporating, and in some countries this is being done, a strategic purchase, including certain elements having to do with poverty conditions of the population, to adjust for risk and to promote equity or equality amongst the different countries. But when we speak about strategic purchase and social determinants, how can we finance social prescriptions? That is, intersectorial interventions that are key to modify behavior and standard of living of the population, and interventions on behalf of schools and also different areas, non-state areas that are key to improve these living conditions and effectiveness and efficacy of interventions in healthcare. Medical, not only medical, but also prevention and promotion of healthcare. The third element I want to point out that has to do with healthcare program. We are used to prioritizing certain elements, and we have a repository where we add programs in a very fragmented way, in a certain way. Lessons learned here are that even though you may be incorporating objectives having to do with improving performance and increasing coverage in the results, etc., of certain programs, these programs have to be included in a strategic logic. Integration strategy having to do with public health and having to do with the component of the question you mentioned. Integration to prevention and promotion policies. In this case, even though I mentioned this, there are countries that have service packages where they've incorporated prevention elements. I would say that we need to explain these institutions, and this is a key element. But not all countries have service packages, and not in all territories where we would like to modify the organization of healthcare services. This is the best element. I believe that in a complementary way, we need to finance different structures of prevention and promotion of health. And this implies that the strategic purchase needs to be at the service of generating sustainability of these structures. And last, you asked about the different conditions that are necessary to guarantee certain sustainability of these prevention and promotion policies. And finally, I need to remind you about fragmentation. The document states it clearly that when we speak about fragmentation, we not only speak about fragmentation of services, but also fragmentation of the whole system that sometimes becomes a barrier for delivery and efficient delivery. When we speak about a long-term agenda, when we speak about reforms, etc., as Javier was saying, the example of Panama in the short term, I believe that when we speak a condition, we need to reinforce capacities, critical capacities. We need to think about the capabilities of the different players and the instruments that are used upon strengthening an agenda that is reinforced over time. Thank you very much. And I think my time is out. And I thank you once again for allowing me to speak in front of you. Thank you, Ernesto. And let me speak about or summarize these points. Javier talked about the global context and the regional context, about the difficulties to expand the taxes or fiscal space to provide more space to healthcare and chronic non-communicable diseases. He also mentioned the digital transformation as an important facilitator for healthcare integration, and also for how to, in a certain way, uh, soften institutional fragmentation. And he spoke about the digital transformation as an engine. Maru talked specifically about healthy taxes, and I think she mentioned something very interesting, which is that there is a design problem, and the design problem affects sustainability of these taxes over time, which are sometimes very rigid, but sometimes we need this rigidity to uphold policies, but they have a complicated side to it when they are not flexible enough. And this requires a lot of political will. And Ernesto basically um, spoke about the partnership for the strengthening of primary care, which is today a platform that PAHO, IDB, and the World Bank are working on, that is providing a space that never existed before in primary care in order to guide the healthcare policies towards NCDs. And he spoke about fragmentation, which is something that we've repeated over time. He provided some solutions to the aspect of fragmentation through the creation of communicating vessels for the continuity of care focused on prevention. So I simply want to thank you all. It was a deluxe panel. Thank you very much. And I believe that you've provided us and this webinar a very important visibility. Thank you very much. Thank you. Thank you. And now it was very interesting. We are going to start with the last block of this webinar. Please hold on and remain a little bit longer, those who are participating, because we need to deal with the last block that is going to come with the presence of Valentina Estaco and Paulo Ulashi from the IX that are going to introduce the FAN network for Latin America and the Caribbean. Valentina and Pablo, you have the floor. Thank you, Sophie, and good afternoon. Yes, the aim of this blog is to introduce FAN network and how it can contribute in the region and offer some opportunities for continuity of all these challenges we were commenting on throughout this webinar that were mentioned by Natalia in this presentation. FAN is a global network that seeks to connect different actors with initiatives and knowledge. Um, and responds to other challenges that exist in these innovative initiatives that are not documented. FAN intervenes here with the mission of strengthening sustainable finance for NCDs and contribute in healthcare systems for equality. This is what FAN does. It has two aims for sustainable development. It has to do with universal health coverage, financial protection, and also avoid and mitigate premature mortality through NCDs. The next slide. How does FAN do this? Through three axes that combine combining finance with other things. It contacts players for them to share knowledge and lessons learned, not only how they implemented initiatives, but it also seeks to share the weaknesses, the obstacles, how they implemented these innovative initiatives. And how was this possible? The second thing has to do with the foresight, and this is related to the follow-up technical assistance, and how we summarize evidence for it to be available, for this information to be available, and for decision-making process. And the third point is the FAN fund that has to do with catalytic capital and everything related to financial support for initiatives that are underway or initiatives we want to accelerate that otherwise we would not find support to them. This does not replace public funds, but it leverages innovative initiatives with the aim that they work in the long term and incorporate them in public policies. FAN works and expands the network through regional accelerators. This started with AFIDEP in Africa, Sub-Sahara Africa, and now was expanded to Latin America, selecting the IX as accelerator. The aim of regional accelerators is to articulate between FAN and the region. This is why FAN selects organizations with experience working with local players uh, and provide technical training. The idea in the future is that the IX plays this role in the region and accompanies countries, identifying its priorities and needs, and also if they decide to move forward with catalytic capital request, that they follow up this proposal. Now I will give the floor to my colleague Pablo that will talk about how the countries can participate and get involved. Thank you, Valentina. Thank you very much. Good afternoon, everybody. It is a pleasure to participate at this webinar. After the words of Valentina, I need to talk about the idea in the organization of this fan network in Latin America and the interaction of the IX as a regional accelerator. The country is a participation unit, including government organizations that, in articulation with other multi-sector players, they participate in these Latin American networks. There are two ways of participating in these networks. And at the end, I'm going to leave you a questionnaire where you will see some other options. But the two important ways of participating are as a member or as an affiliate. As an affiliate, you participate in a more flexible way where you're invited to participate in events to construct knowledge, tools, and events. They may conform a team for national articulation, and they will receive invitations for virtual seminars and other events. They can participate in this way. Nevertheless, if we move on to the definition of a member country, here the level of involvement is stricter and higher, more active, where we want the country to participate actively in the drafting of knowledge papers and tools, forming a team for national articulation. It will receive invitation to events or remote events. And the idea is that they may access in more than one opportunity to these different opportunities for initial ideas. And also for the member and the affiliate, we want to share lessons with global audiences through these meetings and documents we are creating, which are the spirit of this meeting. For these people that show interest in becoming member or affiliate, remember that we are going to share with you this material. You can look into the form that we are going to send you if you want to become a member or an affiliate. Next, I said that the affiliate and also um, the member that is stricter as to participation, they create an articulation team at a national level. Here we refer to the set of players related to the finance of NCTs that see NCTs that will articulate with the IX and the rest of the network FAN. In this exchange, the FAN participation becomes a local agenda adapted to the context of the country. This national articulation team is going to prioritize the problems and barriers at the local level. It is going to connect with the network. It is going to accompany the implementation of initiatives and is going to share with the rest of the network the problems, the successes, the failures, and the tools. The characteristics of the team between 3 to 8 members that be led by institutions of the country from the public sector, private sector, and civil society, linked to the problem of chronic diseases. And we need to do synergy with the capacity of local action and anchor ourselves in established networks and create synergy with these existing opportunities. In articulation with the national team, we need to define the focal point, the leader, the player that is going to have the connection between the local aspect and the accelerator, which is the IX. Next, please. Valentina mentioned this already, this concept of FAN, and this is a catalytic finance strategy to support ideas, initiatives, priorities that don't want to substitute the public finance, but may contribute to design, support an initial idea, or expand an initiative. We have talked about there being an association as an affiliate or member, but the summons to receive ideas for the support of finance is open also to countries that have not presented a request and are not FAN members. At the end of this webinar, we are going to provide you with a form where you will see which is the interest and the level of involvement that you want to have with the network in order for us to contact you. What are the next steps after these FAN definitions of Latin America? First, to complete this form that you will receive, where you will be able to declare, yes, declare if you want to remain informed, updated, informed about different things or explore your participation with member countries or affiliate. So we are going to give you the specific form for this application. If you want to be part of a national articulation team, or if you want to explore the opportunity of finance through FAN, you will have the opportunity of detailing a preliminary idea that you want to comment on, and the completion of this form does not imply any formal application nor request for present finance or funding, but we will use it as an important feedback on this webinar in order to make contact with you based on the interests you express. And for the third point, I'm going to start with the construction of Latin American network. I'm going to give the floor to the director of the research department, Vilma Irazola. cardiologists and investigator. Thank you, Vilma. Thank you very much, Pablo. We are arriving at the end of this meeting, and we want to thank you enormously uh, for being here today. And especially, we want to thank the members of the panel. As we said, we have a great panel, so we want to thank them especially because they generously shared with us their knowledge and their experience. So thank you very much. And we want to thank accelerating the IDB, and all those people that make this network possible for Latin America and the Caribbean. It is a pleasure for us to invite you, as Pablo said and Valentina said, to be part of this uh, project or community at a regional level as an affiliate or a member, in order to turn knowledge and to turn this change into political decisions and material actions in the area of funding of NCDs. Once again, let me remind you that at the end of this meeting, we invite you to complete the form that is going to be available to you, even though you may not have defined yet your level of participation. No doubt, this is the first step to continue with this exchange. Thank you very much. Thank you very much, Sophie. I believe we are closing now. Yes, yes, because we've exceeded the time assigned. Thank you very much, Vilma, for your words. So we want to say goodbye, and you may complete the form that I shared with you on the chat. But this information, you will have it. So thank you very much. You will get this information and the information we shared with you today at this webinar. Thank you very much. And the forms and everything and more information about how to be part of the FAN network, you will be able to have it in your emails. Thank you.